This is the Tioga County COVID-19 Task Force Update. I'm Jim Nobles. We're here today on the beautiful campus of Mansfield University for the Task Force third masking project with the goal of assembling masks to be distributed throughout our community. The task force could not be prouder of the accomplishments of the volunteers that participated in the prior masking events as well as this masking event to distribute over 15,000 masks to our community businesses so they can offer that to customers frequenting their business. The task force firmly believes masking is not a political issue. It's an issue of health. It's an issue of physical health, and it's an issue of preserving our economic health. And we really don't have to choose between the two. What we'd like to do is assemble these masks and provide them to the businesses so they can offer them to their customers, and I couldn't be prouder of the success we've had. We are joined today by Dr. Charles Patterson, the president of Mansfield University. Dr. Patterson, this is the third time you've allowed the task force to use this wonderful facility on your campus. Why is this important to you, and what does it mean both as the president of a university and as a citizen of Tioga County?
Well, thank you for that question. I'm going to remove my mask since we're properly distanced and respond to your question. I think this is a real example of community engagement that the university cherishes so much. The ability to partner with our county commissioners and with our healthcare agencies and around the region for the health and safety of our community and the health and safety of our students is paramount. As we regain in-person instruction in the fall, we will start August 17th. It will have a number of students coming back to campus to engage in in-person instruction. The ability to keep our students and our community safe through a masking program like this with the community is very, very important.
Perfect. Yeah, thank you, Dr. Patterson, and that brings up a good point. We've talked about your students coming back to campus. You're only a couple weeks away from that now. You have a great safety plan. Can you talk to the viewers a little bit about what that plan is as we bring students in from around the state and the country to repopulate your campus? How are we going to ensure their safety and the safety of the community?
We're constantly communicating with our students right now about expectations of campus. We're asking them to take care of themselves and socially distance while they're away from campus, and to make sure within a 2-week period they have continued to do that before returning to campus, monitor their symptoms, etc. As they come to campus, we have allowed for a drop and go process for their belongings in the residence halls. Our classrooms will be properly socially distanced. We have multi-modalities that we plan on for instruction, so the ability for some in-person classes to have lower density, for multimodality to be at a distance, so we might have some students in class at the same time that some students are streaming courses online. And of course we have fully remote courses as well to reduce the density overall on campus.
Dr. Patterson, I can't thank you enough. This is a perfect example. The task force has talked about this ever since the disease started way back in March. We don't have to choose between physical health, economic health, or in this case, educational health. You've done a wonderful job pulling together a great plan to make sure our students are safe and the county is safe, and the task force thanks you very much.
Thank you very much.
Stay with us. When we return, we'll be talking to County Commissioners Hamilton and Coolidge.
We're opening up again, so you don't need to put your healthcare on hold. We're open to see you for in-person appointments. Open with extensive precautions for patient and staff safety. And open with rigorous cleaning and disinfecting at all locations, from emergency departments to primary care offices. We're open and can see you now. UPMC, life-changing medicine.
Welcome back. Commissioner Hamilton, thanks for joining us. This masking project is so important to the task force. What does it mean to you as a county commissioner, and how has this resonated with our community businesses?
Well, being the third time that we've done this and trying to wrap up with, I believe, 15,000 masks, we've been getting some really positive feedback from the businesses and different people that we've been distributing them to. They've been very appreciative of having a positive approach to trying to get their customers to wear the masks in the stores. And our feedback has been that they're going to use them.
So there's still some that are skeptical of the entire masking validity as well as the nature of this project. What's the one thing you want the county to take away from this masking project on the importance?
Well, I'm not sure the science is as important as understanding that you need to respect those around you. You know, you don't know as you walk into a business what that person in front of you or where the person in back of you have been. They could be a healthcare worker that just came from testing COVID patients. So I think that's something to think about, so that you're respecting yourself from those people, but you're also respecting those in your community that may have a more tendency to be able to pick up this disease than you yourself.
Commissioner Hamilton, thank you very much. Very profound statements. We just don't know, so err on the side of caution and we'll mask up Tioga. Commissioner Coolidge, the task force has proclaimed that we don't have to choose between physical health and economic health in Tioga County. How is this masking project important to you as a county commissioner, and what does it mean at the state level?
Well, we're stuffing masks in the other room, but I'll take this off for a minute. Here's the circumstances that prevail. The whole Commonwealth has been asked to shut down. And the circumstance actually is in 3 or 4 different areas throughout the Commonwealth. Our encouragement to the governor and to his executive staff is to reconsider that and give us the privilege of, to those institutions who have followed the protocol to a T, protecting not only their personnel, but those who come within and out of their businesses. And so in this past several weeks, we've had that engagement and that discussion with the governor and his staff, and we're still pursuing it, especially of the latest action to reduce from 50% in restaurants and so on to 20%. And we're going to continue that conversation.
Yeah, absolutely. That's so important to continue that dialogue. And you do have ongoing dialogue with the governor's office, as I understand.
Every other Friday, we have a half an hour with the governor. There are 6 people who were invited out of the County Commissioners Association to speak directly with the governor. And in that exchange, I think we've gained an appreciation for both sides having a position that we're considering our economy in our communities. And we're considering the health and welfare, but so is he on a broader scale. And this past Friday, I had the chance to compose a conversation with him in regard to what the task force is doing here in Tioga County. And I mentioned that at the conclusion, there'll be some 15,000 masks to be distributed to various businesses and industry across the county. And he interrupted the conversation to say thank you and congratulations on the effort that's being put forth by the task force in Tioga County. And that's saying quite a little bit, to have him pause and acknowledge what's going on here. But what's going on here is community, people who are volunteering, who want to make a difference in the future and the welfare of our county.
Absolutely. Well stated, Commissioner. The task force has always said community means everyone. 15,000 masks, over 50 volunteers that contributed over 600 man-hours, and hundreds of businesses helped throughout Tioga County. Please do your part and mask up Tioga.